All right, so on your guys' desk, you have your handouts, okay? So a couple of pages of notes, and then the little purple thing we'll use at the end, okay? So you don't need to use that yet. All right, so quick review. What is a floating bone on top of your knee called? Jonas.
The patella.
The patella. What type of bone is it? Kneecap? Nope. What's a bone type? What's a type of bone?
Floating.
Floating. Okay, but it has a special name. But that is correct.
A flat bone.
It's not a flat bone, but that is a type of bone.
Short, long.
Right. Short, long, flat, and then this one.
Joint. Round.
There's two in your foot that are very small under your big toe.
Supposedly.
No, I was just saying two, like bunny rabbits.
Can't confuse me like that.
Skittles.
The minotaur.
No.
I know what that
Starts with S.
This is what it says.
Sesamoid. Okay, so your patella is the largest sesamoid bone in your body. Okay? So those two little sesamoid bones under your first big toe, those are sesamoid bones because they're floating, right? What do we mean by floating?
Not connected to any other bones by ligaments.
Not connected to any other bones by ligaments. So how does it stay there? How does your kneecap stay there?
Hold it in place. No.
The muscles? Okay. What are connected to muscles? What connect muscles to bones?
Ligaments.
Muscles to bones.
Joints.
Tendon. Tendon.
Oh yeah.
Okay.
Patella tendonitis.
Thank you. Okay. So your patella is connected via your tendons. So which tendons are those?
Let's hear about it.
Okay. So here's your patella. Okay. So these tendons up here. Do we know what they're called?
Not yet.
Not yet. What did you just say you have?
Patella tendonitis.
Patellar tendonitis. Okay.
Is that patella tendons?
Patellar tendon.
Oh.
Okay. So that's going to be the bottom one. Okay. This is the patellar tendon. Okay. What do we think the top one's called? What's it connected to?
Superior.
It is superior. But what is it connected to? What is this tendon?
Moral.
What do tendons connect?
Oh, muscle.
Muscle. So what muscle is this? Your quad.
Quads.
So this is your quad tendon.
Is that the foot? It's just a quad tendon.
It's just called the quad tendon.
No, they're tendons on the quad.
Quad tendon, patellar tendon.
I already like the knee more than the hip.
Yeah, most people do.
Well, with the round part, that's it. Like there's like that round part.
That's just the tendon that just goes over the top of it. That's how it's floating, right? So it's just that whole tendon. Doesn't have a name. All right, so quick intro to knee, right?
Did you skip this today?
All right, so at your table, you need to number off 1 to 4 for today's activities. If you do not have 4 at your table, somebody might have to go twice.
Don't worry, guys. I got 1 of 4.
Okay? So figure out your numbers.
You call 1 or 4, I
Where's
will be
Tyler?
filing a lawsuit. Huh?
Where's Tyler?
I don't know.
He didn't want to be here.
Was he here yesterday?
Yep.
He didn't want to be
He
on
got a
camera.
haircut.
He did? How bad is it?
Buzz cut.
It's a buzz cut?
Yeah.
How short?
We go to airports,
Not
right?
too short. It looks good. Tyler
Is it like an
Tyler
airport?
can rock everything.
Tyler can
Oh,
rock everything.
I don't know if he could rock that.
Nah.
No,
The Jonas.
Tyler's built different.
All right, everybody got a number.
He's getting ready for the F4 Academy.
Everybody got a number?
I got 2.
Okay, good. All right, so learning targets. Remember the good old what, why, square. So I'm going to tell you what we're going to do today. Okay, we're going to do intro to the knee unit, right? I want you guys to tell me, what does that mean to you? Okay, so discuss amongst your tables. Then we're going to draw a bone. Whatever number that is going to answer that question. Okay, so everybody should have an answer. What does that mean to you when we talk about knee, intro to knee unit? What do you think we're going to do? What do you think we're going to learn?
Like, what is it?
What does that mean?
Feeling I think you need to take into consideration 1939 and what happened there.
What about you?
All right, you guys got answers? Everybody got an answer? All right, Adrian, draw a
I
bone.
don't think you want mine.
Please.
Is it 2 or 3?
What number is it?
2.
2. So the 2s are going to answer.
Why do I have to start?
You don't have to start.
What is a knee?
Okay, 2s. What do you think the knee unit, intro to knee unit is going to mean? You're going to be learning about knee injuries. Okay, good. What do you guys think?
Starting with like the basic anatomy of the knee, and then until getting into like tendons and muscles, and then injuries.
And then injuries. Okay, what about you guys?
Basic anatomy of like the knee.
Basic anatomy of the knee.
Like how to keep your knee like healthy.
How to keep your knee healthy. How to keep your knee healthy. What do you guys think?
Like rehab stuff.
Rehab stuff. What do you guys think?
Like mechanisms and symptoms.
Mechanisms and symptoms. What's a mechanism? What does that mean?
Movement.
How something happens.
How it happens.
Oh, right.
How it happens. What do you guys think?
I think we're gonna mainly focus on knee injuries because you can have many different like knee injuries, and knee is a very
Knee sucks.
fragile point of your body. So I
Yes.
think we're gonna start with like the basic knee injuries, and we're gonna like get more complex.
I just asked.
There is a lot,
I
yes.
asked that we don't watch a lot of injury videos because those hurt my everything. And
So you want a lot of knee injury videos?
when that knee pulls inward a little.
Okay. All right. Next question.
Nightmare.
Why do you think this target is important? Why is it important that we learn about knee stuff? Talk about it. I'm going to draw another one. Yeah, you only got 2.
Can you call me?
No, so I draw it again.
If it's one of my numbers, can I talk first?
Are you gonna draw it?
Yeah, I'll draw it.
Well, I already picked your table last time. I should probably rotate.
But like, just let me talk first.
What if it's not your number? What if it's not your number?
Well, if it, then I don't.
3.
Not me.
To keep it healthy.
All right, 3. Why is this important? Why is it important that we learn about knee?
Wait, what did I just say? I literally just forgot. Because I feel like that's where the more serious types of injuries occur.
What did you just say?
The injuries.
Oh, okay. Please say it again.
I feel like that's where the more serious injuries occur is at your knee.
Okay, most serious injuries at your knee. Achilles tear is pretty serious. What do you guys think?
It's important to know the types of injuries so you can try to prevent it.
Try to prevent it. Good. Okay, what do you guys think?
It's like, well, the knee's like important for like daily functioning and like using it a lot, yeah.
Daily functioning. Definitely something we use all the time.
Basically like knowing what to look for, like in cases like, especially on sports or something like that, if your teammate has something like that, try to like help prevent them too.
Okay, helping out your team, knowing what's going on. What do you guys?
Why is that? I would say. Can I?
You can say it again. They already said your answer. To prevent injuries. What do you guys think?
It's like it's an important part of the body, and like, we use it a lot.
We do. Okay. So, what did we hear there? Most important part of the body. We use it all the time. A lot of serious injuries happen there. Kind of important, right? All right. So, you guys were right. We are going to learn about specific knee anatomy. Learn the assessment process, right? How do we assess injuries? What are the steps that we do to do that? Common injuries of the area, treatment techniques, and special tests. Okay? All right. Okay, so now we're going to go on to our inquiry chart. You guys have a handout with a chart on it, 2 columns. Okay? So our first question is, what do you know about knee injuries? Okay? So that's going to be our first question. What do you know about knee injuries? You unfortunately know a lot.
I did.
Same.
Wish I didn't.
It's that chronic knee pain.
Okay,
Yes.
so at your table, I want you guys to write down 2 things that you know about knee injuries already. Okay? Same thing, we're gonna draw a bone, so everybody should have an answer. Okay? And then your next column, we're gonna do the same thing about what do you want to know about knee injuries. Okay? So what do you know about knee injuries and what do you want to know about injuries?
First point is pretty goated. Ouchie,
All right, and on your handout, I want you to write everybody's answers down, okay? So you guys have your answers for your table, but then when we share out, I want you to write those down on your paper so we have all of them. What you know about it?
I know. Then they can happen at any time.
Okay. What else do you know? Do you know one?
ACL. That's all.
Write it down. Do you know what it is? How to do it? Anything about it? You just know that it's common?
Yeah. Shut up. We can still let's talk.
Yeah. So you do those kind of things.
Let's write more than just keep writing.
I wanted you to do the other column too.
Oh.
Yeah, we're doing both columns right now, and then we'll share out. You don't have that. All right, you guys got your answers? Here you go, Rory.
2. Number.
2 again. All right, so number 2, I'm going to ask you, what do you know about knee injuries? Number 2.
It is the sesamoid bone. Or the patella. That is
What?
the patella that is like in the knee. It's a sesamoid bone.
Okay. Patella is sesamoid bone. Okay. What about you guys? What'd you guys get?
They can happen to anyone.
It can happen to anyone. Is that what you said? Okay. Can happen to anyone. Okay. What do you guys get?
That they're like somewhat common.
Common. Okay. All right. What do you guys have?
They can happen at any time.
It can happen at any time. All right. What do you guys got?
Severe can result in surgery.
Severe can result in what?
Surgery or amputation.
Surgery. All right. What about you guys?
Tearing or dislocation.
Tearing. Okay. Tearing of what? Okay.
The dislocation of the knee.
Dislocation. What's dislocation mean?
The joint is in the wrong spot.
The joint is in the wrong spot?
The joint disconnects. I don't know. It's
Not in the right.
What is not in the right spot? Well, what are you dislocating? So if you say, I dislocated my knee,
Your kneecap.
your kneecap. right?
Yeah.
Yeah, so your patella. Okay, what do you guys get?
I can have a very long recovery time.
Long recovery time. All right, so you guys know a lot about knee injuries. Kind of unfortunate, right? Right?
Yes.
Yep. So it happens to you or yourself or somebody you know, right? Like we said, knee injuries are pretty common. So it happens to a lot of people. I'll take number 2 out so we don't draw it again. 1. All right, number 1. You're going first?
Yeah.
All right. So what do we want to know about knee injuries?
Like what you can do to prevent them, or like how you can, like how to not do it again.
Prevention and avoid re-injury. Okay. What about you guys?
The different special tests.
Special tests? I should have chose a different pen.
Specific diagnostics.
Specific diagnostics. What's a diagnostic?
The type of injury, and the doctor gives a diagnostic to tell the patient what type of injury.
But what is a diagnostic? Like, what's an example? Are you talking about like an X-ray? Like an MRI?
Yeah.
Well, what do you mean? Like,
Any of this. In
to
general.
try to figure out what's
Just
wrong with it,
general
right?
thing.
Okay. What do you guys got? What do you want to know?
How to take care of a knee.
How to take care of it, okay? How to take care of it to avoid injury, or how to take care of it after injury?
Both.
Both. Okay. All right, what do you guys get?
The treatment.
Treatment?
Certain
Is there what?
for certain injuries.
Okay. Okay, what about you guys?
How to prevent injuries.
Prevent, okay. Good question.
Oh well.
Last one.
Oh, the different types of symptoms for different injuries.
Symptoms, okay. All right, perfect. So that's a lot of good questions, and we should be going over all of those. So by the end of the unit, you guys should have a good handle on answering all of those questions, okay? So we'll keep this handout, and we'll go back to it afterwards and make sure that we checked all the boxes, right? All right, I'll put 1 and 2 back in there so you guys can get called on again. All right, so now we're going to move over here. You can flip your paper over because we're going to go on to our CCD, Cognitive Content Dictionary, okay?
Yeah.
So we have 2 words. 2 words. First word. All right. So, first word, condyle. Condyle. All right, so say that with me, you guys. Condyle. Condyle. Say it really loud. Condyle. That's not very loud.
We don't want to be loud because we're not getting home.
Why? I want to yell.
Like, no. It's too early. I'm like trying to be asleep right now.
It's early in the morning.
I'm trying to sleep right.
I know, it's really early, so we can whisper. Condyle. Okay, what would be another way that you would say that? If you guys saw that word, how would you pronounce it?
Condyle.
Condyle? Condyle?
Condule, pretty much.
Oh, condule. Of course. Condule. Condyle. Okay. So we say condyle. That's how you pronounce it. Okay? All right. So How many of you have heard the word before? Raise your hand.
I don't want you to ask me the definition.
No, I just, have you ever heard it? That's all I need to know. No? 0.
No, I'm really not.
Hey Siri, say the word conduct.
I guess it's good that we're learning it.
I've heard it, Siri told me.
Oh, Siri told you? Good. All right, so I want you guys to, in your tables, put your heads together again. Try to figure out what you think the word means. Okay? What do you think the definition is? Condyle.
Con is negative space. It's con.
And hopefully we pick number 4 this time.
Let me do it.
If we pick 2,
And maybe we'll pick 2 again.
if we
I
pick 2 or 1
freaking
again, I'm
knew
gonna
it.
laugh.
Pretty scared.
You only have 1 number.
Okay.
I only have 4.
Who has 4? Of course. Of course. I should have known that.
Like a thing that exists.
concept of a need.
What do you think it means? Do you think it's like a person, place, or thing? Do you think it's an action? Do you think it's a name of a special test? Do you think it's a bone? Do you think it's a person?
It could be like a device, measuring
It
device.
could be a device, like a goniometer.
Some pretty weird words.
Name
Who would name a goniometer? Maybe it's a measuring device.
Is that a hint?
No, that's what they were saying. It's like, why would you name it condyle? I was like, why would you name it goniometer? Right. Right. Stethoscope. Otoscope. All of these questions.
Ophthalmoscope.
Whoa, did you just make that up? All right.
Three.
No, that's not
3. All right, 3, 3, 3. 3.
I got 3.
Oh, okay. All right, so what are your predictions? Table 7. What are your predictions?
It's like a muscle or a ligament or something.
Muscle or ligament?
We have to think about that.
Yeah, so write down all of the answers on your paper. But save space. Oh, it is. There's another word, so make sure you just put it in the top word. All right? What do you guys think it is?
We don't know, but we disagree with that one.
Yeah.
Yeah.
You agree with that one?
No, we disagree.
Oh, you disagree.
Yeah, we don't think it's.
Well, then what do you think it is?
We don't know, but we disagree with that one.
Not an answer.
Right, that's not an answer.
We just think table 7 is wrong.
It's not an answer either. What do you guys think it is?
You're not right.
Bone. Okay.
There is no way.
Okay. What do you guys think it is? Part of the knee bone. I'm just going to put another tally mark there. Okay. What about 4? What do you guys think?
special test.
Special test.
I would guess.
Table 5.
Like hyperextension of the knee.
Hyperextension of the knee.
Yes. Yes.
Oh, is that what you guys think it is?
No, this is what the French guy thinks it is.
Condyle.
It's not that.
Table 6. Ligament.
Special test actually.
All right. So 2 votes for bone or muscle.
So
Muscle or ligament, and 2 votes for bone.
So it's gonna be something lower though, because the
Lower.
Latin prefix is con. It means negative. Negative.
Like it's something.
Look at you analyzing the word.
Yeah,
Well,
but
that-
it's
Yeah,
over
but we
there.
can't figure out what.
but
the
that would be
second-
like sub, Taylor.
Yeah, so
I
that's
think
my
you're
worry
saying
is
it might be
thinking that
special
it might be like a lower, smaller bone in the back of the knee.
Yeah.
We want to change it to a bone. We think it's a bone.
Oh, okay. What did you think before? Ligament? Yeah. Okay.
Take your point off. I think it's a special test.
All right. So, ready? Ready for the answer?
It's a special test.
It is a bony landmark. On the, guess what bone? Femur. Okay. So, an example. It's not really an example because it is what it is.
That makes sense. Positive and negative, you know what I mean?
But it is on the underside, or actually the back side.
Yeah,
Okay.
that's what I thought.
So these little circles, those are the condyles. Okay, condyles of the femur. These two little bone on the back side. Okay.
Did you not see me say that I thought it was a bone on the back of my knee?
No, I didn't. I didn't hear you
I
say
said-
that. You said below. I feel like you said
like,
below.
I pointed the back
You
of
said
my
below. Okay, so if we draw a picture, we got the bone, and then we're gonna go condyle.
Not sure about this one.
Okay, so if we have
Not sure about this one.
two condyles, right? How do we decipher between them?
I can't agree.
It's the
Medial and lateral, right?
Not sure about this one.
Medial and lateral.
You know maturity.
So if we put another bone right below it, what do you think's right in front of it?
The patella.
The patella.
Is it on the back side?
Well, yeah, but when you flex, where does it go?
Down?
On the underside,
Yeah.
right? So,
This is flexing. I'm flexing my knee.
okay.
Flexing all the time.
So keep in mind that it moves, right? So if we say it's on the posterior side, but then if we flex our knee, it moves to the underside, okay? So keep that in mind. Obviously, we'll talk about it later, okay? So the definition, protuberance at the end of some bones, okay? So it's on other bones too, not just the femur. We're talking about the knee, so we're just going to talk about that. Okay? There's our sketch, okay? The condyles. All right, so use the word in a sentence.
You have more than
You
two
only have
condyles.
two?
Definitely more than two.
You could say I have two condyles on my right knee, right?
Yeah, at least four, but I think there's more.
One of my
Only two.
condyles fell off.
But if you said on my femur,
Your fingers have condyles.
no.
No.
Only your knees have condyles?
I would say you're old enough.
Your femur, or not your femur.
Yeah, your femur. Your femur.
What's this one?
Well, what is it? It's funny.
It's humor.
It's humor. It's
Does your
humor.
humerus have condyles?
Yes, your humerus has
Yeah.
condyles.
Two.
Yeah. So what's that in common?
Huh?
What's in common with the femur and the humerus?
It's a hinge joint.
It's a hinge joint, right? So that's why. All right. So Isaac brought up a good point. He said, what are the other bones that have condyles, right? The other bone that has condyles is the humerus. What is the femur and the humerus have in common? It's a hinge joint, right? So it allows for gliding, okay? All right, so our next word, intercondylar fossa. Intercondylar fossa. All right, say it out loud. Fossa. Intercondylar fossa. Okay, so whisper. Yeah, so this is going to be in the next box below. Okay, so it's the next word down. Okay, who's heard of this word? Or these words? You've heard of fossa, good. Okay, okay.
Yeah.
Yes, no, kind of. I'll say like 5. How's that? 5.
No.
We have a vision.
Fossa is like here.
Fossa.
Or like in the sides.
All right, so at your table, write down what you're thinking, what you think the definition is. Break down the word, break down the word. You cheat. Cheater. I'm just kidding.
How dare you?
This is like Isaac's gonna ask Siri. I
I
said don't ask Siri.
Can I say the inner?
What is like? There's like a word. Literally, what intended or
Yeah, there was a word for it.
what? I can't like
Intercondylar fossa.
No, but like what? Fossa has like a word for.
No, it doesn't.
Is it like
So what? Where did you know it from before? Like
from the iliac fossa?
right. So what was that
It was
area?
The flat part of the bone. It's not the bone. Oh, okay.
There you go.
Are we free to speak?
No, I gotta draw a bone. Fuse again. Is that like the third time?
Yeah.
You should do 4.
No.
It's because 4 is the smallest one, so you have to like draw all the way in.
Yeah, so let's just do 4.
Okay, let's do 4. All right, 4. What is your prediction?
Me?
Yeah.
I think it is a small ligament in the back inner part of the knee connecting the two ligaments, or going in between the two. Like this.
Going where?
Going between the two.
Going
Over the joint.
between 2 bones. Okay, so he said small ligament in the back part of the knee going between 2 bones. Okay? Table 3, what do you guys think it is?
I thought it was a ligament.
A ligament? Okay. Table 4, what do you guys think?
It's the fossa that goes for the knee joint.
What's a fossa?
It's a cushion for the joint.
Cushion? Okay. Cushion for knee joint. All right. Table 5, what'd you guys get?
Like the inner part of the condyle.
The inner part of the condyle. Okay. See where you're going with that. All right, table 6.
We said like another bony landmark.
Bony landmark. On what bone? No answer. Okay. Table 7. Flat part of the bone? Table 9, what'd you guys get? Flat part of the bone. Another vote. All right. So we got a lot of options. We have ligament, okay? A ligament in the back, specifically. Cushion for the knee. Inner part of the condyle, okay? Why'd you guys say that? Because it's intercondylar, okay? Bony landmark. And then a flat part of the bone. Why'd you guys say flat part of the bone?
I think table 4 is right.
Because that's what fossa means?
I think table 4 is right.
You think table 4 is
I
right?
think table 4 knows what's up.
Cushion for the knee joint?
I feel like they're pretty smart.
All right.
Respect to them.
Okay, well, let's look at our diagram. Okay,
do it.
so what were these?
Condyle.
The condyles. Okay, what does intercondylar mean?
In between them.
In between,
No way was I right.
right? So in between condyles. And then fossa we know is the flat part of the bone.
Oh, so
Okay?
I was right.
So it's going to be the flat
Yeah, it
part
was.
in
No,
between the condyles, right? So this is usually where, sorry, let me push the button here. Okay, groove between the condyles is the definition specifically. Why do we need grooves in our knee? So it moves. Because it's what type of joint? A hinge, right? So it would be in the same picture here. The intercondylar fossa is going to be right below, in between the condyles. Okay? So in a sentence, what would you say?
Wait, is that in the arm too? Is that
Yeah, same idea. In the arm because of the humerus, right? So I would say, if I was to use this in a sentence, I would say the intercondylar fossa is a place of attachment for ligaments. Okay? Because if we look at this diagram, you see that's where the ligaments are connecting, right? Okay, so it's a bony attachment. Bony landmark is right, because that's what it is. Bony landmark on what bone, though?
Condyles.
What?
Condyles.
No, what bone?
Oh, femur.
The femur. Okay, so intercondylar fossa is a bony landmark on the femur. Good. So you guys are learning about words that we're using more often. Okay, so you'll see that a lot in anatomy when you talk about fossa, right? So where did we hear the word fossa before? Where did you guys hear that before? The iliac fossa, right? So we talked about the ilium had a fossa. So lots of bones have fossas, which is a flat part of the bone, which is called a fossa. Okay, good. All right, so we're going to move into some anatomy. So in your packet there, you guys have some info, okay? So when we talk about intro to the knee, we're obviously going to talk about anatomy first, right? So we have a baseline. We're going to talk about ligaments, bones, muscles. What else do we have in the knee? What else have you guys heard of in the knee?
Meniscus.
Meniscus. What is meniscus? Anybody know what a meniscus is?
Cushion between your two bones.
Cushion between the bones. Okay. What is it made of? Nobody? Anybody hurt their meniscus before?
Yes.
Yeah? Okay. So it's cartilage. Okay. Your meniscus is cartilage. Okay.
That's why it's inflamed, so you can...
Yeah. Okay, so common injuries of the area. What's a common injury to the knee?
A tear.
A tear of what?
ACL, MCL.
ACL tear. So ligament tear, right? ACL tear, MCL tear, those are pretty common. What else?
Dislocation.
Dislocation. Okay, we talked about that before. Dislocation of what? The patella, right? Okay, what else? What other injuries? Tendinitis. Okay, a sprain. What would you sprain? What is a sprain? To the ligament. Injury to the ligament. So there's lots of ligaments in the knee. So a sprain could be any one of those or more than one, right? All right, so how to assess them. So the knee is pretty complex. There's a lot of things going on. Okay, you got bones, you got ligaments, you got muscles, you got tendons, you got cartilage, you got bursa, you got fat pads, you got plica, you got lots of things. Okay, so it's a pretty complex area, and it's really hard to diagnose because of that. Okay, so we're going to learn special tests to perform to kind of differentiate that diagnosis, so we can kind of narrow it down to what it might possibly be. Okay, and then obviously how to treat those. All right, so bones. These are pretty easy. We already know these, right? Okay, so we got the tibia, fibula, femur, and patella. Okay, so in the picture, the femur we know is the most, how would we describe that? If we're talking about the knee joint itself, the femur is the most what?
Superior.
Superior, okay? If we were talking about inferior, what would we say?
The fibula.
The tibia and the fibula, okay? If we were to say lateral, what bone would we say? Fibula, okay? What a medial? Tibia, okay? So, and then the femur obviously is just one bone at the top. And then patella is in the front, so what are we going to call that? Anterior, right? So in posterior, there's not a patella, right? So we know that the patella is only anterior, okay? And they're condyles. On the what?
Posterior side of the femur.
On the femur, good. Okay? So, if we're looking at this picture at the top, which view are we looking at in the knee? Is that the front, the back?
Anterior.
Anterior view. How do we know?
You can see the patella.
You can see the patella. Okay, so that's pretty easy to kind of figure out when the patella is there. Okay, if you take the patella away, that's when it gets kind of challenging. Okay, but we'll go over that when we get into ligaments. All right, so we got anterior view here. What's this bone at the top? Okay, what about this one? Below. What view is this?
Lateral.
Lateral, how do we know?
Patella is facing
The patella?
side.
Why isn't it medial?
And the tibia is on the far side of, or the tibia is on the close side of the tibia.
Okay, so we would know from the fibula is on the lateral side, so it's going to be back there. Can't really tell, but it's back there. Kind of a
Slight
weird view.
overlapping.
Yeah. Okay, so what's this bone at the top? Small bone. Big bone.
Fibula.
Okay, so what's that view? This far view? Posterior,
I mean, not
right?
quite.
So what are these white parts? Condyles. Good. What's this bone? Tibia. Okay, pretty easy. What view is this?
What?
Can't really tell because there's no fibula, right?
I
Okay.
would say that it's lateral, but like slightly anterior.
Right. So I would just say in general, I would just say like a side view. Right? Okay, so what bone is this on the bottom?
Tibia.
Okay, what about this small one?
Patella. Femur. Patella. Femur.
Tibia.
What view is this?
Like a tilted anterior.
The
view.
tilted anterior view. Yes. Thank you, Jonas. What about this one? What view is that?
Very anterior.
Posterior.
Yes.
Okay. Why is it posterior?
Because you can see the condyle.
Okay. What about this?
I don't think
That's the.
I'm still sticking with it.
it's just the patella,
I
the
said anterior. You
patella
lied to me.
ligament thingy is
Your
there.
hamstrings.
That's the
Yes, it is anterior because you have the patella. Okay. So yes, these are white.
The
Okay.
patellar tendon
But that's just the
and
front,
femoral.
right? So that's these parts, which is actually called the epicondyles. But we'll get to that. Okay. Epi. Okay, what does epi mean? Above. Okay. What is this? Small bone.
Still the fibula.
Still the fibula. Still
Also the fibula.
good. Wait, what?
What's the middle one?
Sorry. This?
Oh, that's
Yeah.
It's the patella and the femoral tendon and the patellar tendon.
Not femoral tendon. Quad.
Quad tendon.
Quad tendon.
Quad tendon.
Quad tendon. Patellar tendon. Yeah. What type of bone is that? Sesamoid. Okay. So, bony landmarks on the femur. Okay. So, we talked about before, epicondyles. Okay. So you can see the epicondyles both anterior and posterior. What does that mean? Both sides, the front and the back. Okay. So if we're looking at this, the front is going to be the epicondyles here. Epicondyles. Okay. On the back, epicondyles. Okay. Patellar groove. What do we think that is? What side do we think that is? Anterior. Why? Because that's where the patella is, right? So it's the groove that the patella glides in. Okay? So it's kind of like the intercondylar fossa, but it's in the front. So it's the patellar groove. Okay? So that same spot in the back is called the intercondylar fossa. Make sense? Intercondylar fossa is on the back, patellar groove is on the front. Okay? And then you have the medial and lateral condyles. Okay? Those are posterior. Okay? So epicondyles are above, condyles are below. In the front, you can't see the condyles because they're under. So they're only viewed from the posterior aspect. Okay? So if you look at the picture, medial epicondyle, lateral epicondyle, intercondylar fossa, lateral condyle, medial condyle. Okay? So in the anterior picture, we got the body of the femur. Then we have the medial epicondyle, the lateral epicondyle, and then the patellar groove. Okay? So pretty easy. Just got to remember those landmarks. Then we move to the tibia and the fibula. Okay? Intercondylar eminence. So we know what intercondylar means, right? In between the condyles. And then what's an eminence? Have you guys heard of that word? Okay, well, if you have an intercondylar groove, right? What's a groove? Like a dip, right? So you would think that something would go into that dip, right? Otherwise, it would just be flat.
The eminence is what goes into the
The
dip.
eminence is what goes into that dip.
Gosh, I'm smart.
Okay, so it's
I'm really smart too.
a protuberance or a bump, whatever you want to call it. It's that bony part, the little bump right here, that's going to go into that groove, that fossa on the intercondylars. Okay? Then we have the lateral condyle of the tibia and the medial condyle of the tibia. Okay? Same idea up here as in the femur. Okay? There's just condyles, there's not epicondyles on the tibia. Tibial tuberosity, okay? That's just the front side. That's where things connect, okay? So on here, that's where that ligament attaches, is the tibial tuberosity, okay? Then on the fibula, we have the head of the fibula, okay? We all know what the head means, right? Because we have the head in the femur that makes the what? The head of the femur makes what?
Oh, it's the hip joint.
The hip joint, right. So the head of the fibula makes the joint right there with the tibia, okay? Then on the tibia we have the anterior crest. What do we think that means? What's anterior?
Very front part of the bone.
Very front part of the bone. What's a crest?
It's like an arch out of the bone.
Okay, where have we heard that word before?
The iliac.
The iliac crest. So what does that feel like?
Like a ridge.
Like a ridge, okay? It's like pointy, right? You can feel it.
Yeah.
So if you were to touch your shin bone, right? That pointy part, that would be your anterior crest of your tibia, okay? When you have pain there, what is usually it?
Shin splints.
Shin splints, right? So that's your anterior crest of your tibia, okay? And then your tibial plateau, have you guys heard of that before?
Is it where the tibia flattens out?
Right, that's where it flattens out, where it's flat. So it's going to be on the top, okay? You can't see it from here, but it's on the top where the condyles go, okay? Tibial plateau. It's a common place for fractures called a tibial plateau fracture.
Weird.
Just compression.
It's a creative name.
I know, right? Helps out. All right, so here we go.
Here we go.
Our fun.
Yes.
Okay. What's this first one?
The intercondylar eminence.
Ooh, look at you, Isaac. Intercondylar eminence. What's the next one? Right below.
Right below that is the the lateral condyle.
The lateral condyle?
So smart. I shouldn't be that good at English.
Lateral condyle, what? What bone is that?
That is the femur, obviously.
That's the femur?
No, that's not the femur. That's the tibia.
The tibia. Okay. What is it?
The head. The tibula head.
The head. Okay. What bone is it in general?
Tibula.
Fibula. Okay. What is this?
Tibial crest.
Oh, sorry. I was going to the top. My bad.
Okay.
What about this area specifically?
It's the tibial plateau.
Tibial tuberosity. Tibial plateau is on the top.
You're right.
Right.
My bad.
Tibial tuberosity. Okay. What is this?
The shin.
Tibial crest.
The shin. Come on.
Or just
Tibial crest.
Or the tibia. I can't tell which.
What
one
is
to be
the?
which.
Where is the location of the crest of the tibia?
So that's just
Anterior. So it's just the anterior crest.
Yeah.
Right.
Anterior crest.
Yep. Okay. So if we're looking at the next bone over, what's the one on the top?
Femur.
Femur. Okay. The body. What about that next line?
Those
That's,
the femur condyles.
that's medial.
Medial what?
Condyle.
Epicondyle or condyle?
Epicondyle.
Do you think we're looking at the front or the back?
Looking at the front, 'cause you can see the patellar groove.
Okay, and it says on the top.
I'm not looking
Okay,
at the top.
so if we're
My
looking
hair.
at the
we're not
anterior
seeing
view,
it.
is that
Look
the
at me.
medial or the
You
lateral?
can see that through my hair? I can't.
Do we think it's a medial or the
I
lateral?
think it's medial.
I think it's lateral.
I think it's lateral.
I honestly can't tell which way we're gonna be looking at.
Okay, so if we look at this,
Oh, it's lateral.
this knee,
No, it's.
okay, so it kind of sticks out more on this side, and then it's more straight on this side. Okay, so this is
So medial.
so this is lateral side with the fibula, right? So if the part that sticks out further is going to be the medial side.
So I was right.
Okay. So medial epicondyle, what's the one on this side?
Lateral epicondyle.
Lateral epicondyle.
Patellar groove.
Patellar groove. Okay, because on the back side we have, what's that one on the top?
The bottom.
Okay. What's that upper part?
On the left,
Just the next box.
it's the,
Yeah,
the
we'll
medial,
go around.
medial epicondyle.
That's the epicondyle.
Yeah,
Okay. Medial epicondyle. What's the one below that?
it's going to be the medial condyle.
Medial condyle. Okay. What's the one in the middle?
That's the intercondylar.
Intercondylar fossa.
Intercondylar fossa. What about the far one?
Lateral condyle.
Lateral condyle. And the one above that?
Lateral epicondyle.
Lateral epicondyle.
Just give me
Okay.
a test already.
So on your guys' thing, those blanks are on there for you to fill out. Okay? So you can either fill it out now, you can use it as practice, whatever works for you.
Just
Okay.
give me the unit.
My handwriting is not that small.
All right, so here's our exit ticket for the day. So I need you to use your little purple pieces of paper. We're going to do 3, 2, 1. So name 3 things you learned today, 2 questions you have, and describe 1 thing that you found interesting. Okay? So total, you should have 6 items on your paper. 3 things you learned today, 2 questions you have, and 1 thing you found interesting. And when you're done, you can put them in our little box up here that says phones.
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 Put my phone in there.
You should.
No.
So then you don't ask Siri all the answers.
I didn't ask. You asked if I had heard the word before. I told Siri to read the word to me.
So
But I
then you
had
heard it.
before.
Yeah, because Siri told you.
Do we put a name on this?
You don't have to.